I call the member for Southport.
Madam Deputy Speaker, it's with great pleasure I rise to update the House on health services in my electorate in the Gold Coast and to talk about how the Newman government is delivering on our promise to revitalise frontline services for families. Yesterday I toured the newborn care unit at the Gold Coast University Hospital with the Premier and Minister for Health to see firsthand how the expansion of services is impacting on families with premature and sick babies. The new facilities at the neonatal intensive care unit provide specialised treatment to sick babies, the first time these services have been made available on the Gold Coast. The burden and stress involved with travelling to Brisbane daily to see your sick child, not to mention the cost, will no longer be faced by Gold Coast families. The new services has already supported 8 babies born at 27 weeks and over 400 mums with pregnancy complications. The Premier, Health Minister and I were fortunate enough yesterday to meet 8-week-old Alfie, who was born at 27 weeks, weighing just a little over 800 grams. Because of the services now provided at the Gold Coast University Hospital, Mum Penny was able to stay on the coast to be with Alfie during his time in hospital, as well as being available to the rest of her family. Madam Deputy Speaker, I also want to thank the Emergency Department Director David Green and Nurse Unit Manager Joe Timms for taking the time out of their very busy schedules to show me around the Emergency Department earlier last week. David and Joe provided a very insightful overview of life in the Emergency Department and explained some of the challenges of moving into a brand new hospital nearly 12 months ago. The number of emergency presentations has increased dramatically, much higher than anyone could have predicted. Staff are now dealing with as many as 250 presentations a day, when a very busy day at the old Southport Hospital would have been 200. Dr Green has had over 30 years' experience as an emergency department doctor, and he spoke very highly of our current Minister, the Honourable Lawrence Springborg. He described him as the most enabling health minister they've ever seen and said that the minister's common sense approach to empowering local hospital and health boards has been extremely successful. The staff on the ground are seeing great results, and the patients in our hospitals are seeing the results of this government's commitment to revitalising frontline services. I'm also delighted, Madam Deputy Speaker, to advise the House that the former Griffith University Medical School building is to be refurbished to provide a one-stop shop for community health services. 60 staff will start providing services from October this year, and by early next year some 300 staff will be based at the new Southport CBD Health Precinct. Our government recently announced a $12 million commitment from the Capital Fund for the renovation of this building, and we will now see patient-based services in the facility like oral health, renal dialysis support, children's health, child mental health, alcohol and drug services, sexual health and transition to care. It's my great pleasure to be the member for Southport, and I'm very proud of the achievements of our government in delivering better frontline services.